Now, therefore, be it proclaimed on this 16th day of September 2025 by the Pierce County Council and Executive that September 22 is designated Fall Prevention Awareness Day in Pierce County, Washington. Community members are encouraged to attend this event this month to learn more about preventing falls. Thank you, Madam Chair.
Let's give them a hand. Ivan.
Thank you so much, Councilmember Krueger. Good afternoon, and thank you, council members, for sponsoring this proclamation and recognizing this important cause. As you've read, fall injuries continue to be a top reason for emergency room visits among older adults, not just in Pierce County, but across the nation. As pervasive as fall incidents may seem, they are preventable and can be addressed by making simple changes to one's home environment, such as removing trip hazards like electrical cords and throw rugs. There are several evidence-based fall prevention exercise programs available to older adults offered throughout Pierce County. This information can be found on our brochure, and I brought a physical copy here today. I'm privileged to be a member of the Pierce County Fall Prevention Coalition. We are a coalition of healthcare professionals, senior center directors, and community-based organizations who support older adults. They stand behind me today. Thank you so much. Our mission is to reduce falls at home, at work, and in the communities of Pierce County through public education and awareness activities. Our fall prevention brochure includes fall risk assessment, a home safety checklist, fall prevention tips, and community resources. It serves to be an excellent starting point for any Pierce County resident who wants to address this issue for themselves or with a loved one. We know as a coalition that a fall can lead to a fear of falling. A fear of falling can lead to limited physical activity. Limited physical activity can lead to physical decline, which then increases the chance for the next fall, and around that cycle continues. Our mission as a coalition is to provide education and awareness and let the community know that falls are preventable. As my colleague Matt Sattelli would always say, prevention is better than recovering from a fall. Thank you again for recognizing and centering this issue every year, keeping the conversation at the top of minds of our community every year. We greatly appreciate you, and if we have time, I think we have some coalition members who have more to say on the subject.
Thank you. We do have time if we have a couple that wanted to speak.
Good afternoon. Thanks for having us. My name is Bobby Uchef. I'm actually, Peggy Gablehouse was not able to attend today. I am the senior fitness instructor for Keep Peninsula Community Services, which is out District 7, I'm sure we say that. And we're out in the Keep Peninsula in a little town called Home. Many of you may know it as Lake Bay, in the same area. Our program, I teach 7 classes a week, and the 2 classes we teach are SAIL, which is Stay Active and Independent for Life. That is a program, it's a fitness program, and then preferably we'd like people there at least 3 days a week. And what that class teaches or goes through is aerobics, balance training, weights, as well as stretching and cooling down. And the other class we teach is Tai Chi movement for better balance. And both of these classes have been very significant in regards to preventing falls, or as people in particular either have a fall or they become ill, they know they can come back. They have a community of other students with them that helps them come back. So they come back faster and they can get their strength back, which is really important. So it's a way to keep people strong, balanced, and safe. And this is a lovely community. But don't take my word for it. I want to bring Linda up. She's one of my students. She takes both of my classes. And just say what's
Thank you.
That's
Thank you for having us. So I come at it from a whole different perspective. First of all, I can't believe I'm old enough to take a fall class. But believe it or not, all of you will be there someday. And we've all experienced falling, tripping, or almost falling. And so when I first took the class, the sail class, I thought I was going to learn how to sail a boat. But I've gotten very strong, and I've learned that I can fall safely. And the part that I would like to bring light to is something that was brought up already, is that there's no fear in falling when you know how to fall and you trust your body to do what it needs to do when you fall. And we do that through every day, 3 days a week that we do this practice. We practice things like stepping over logs. We don't really step over logs. We use our feet as if we're stepping over logs. And I have learned that my feet are very well grounded and that I need to breathe, because a lot of people that are older sit in their chair and they don't breathe and they don't walk, and then they get whatever that's called, neuropathy, and then they fall easily. And I don't want that to happen to me. So I've learned that my feet are strong and that if I breathe and stand up, I walk differently, I carry myself differently in everything that I do, even when I sit. But the biggest thing that I have learned is that I can trust my body, because by doing these one-step recoveries, it automatically knows what to do. And an instance of that for me was my grandson. We were at the zoo, and he's, a little guy, and he's running everywhere, and he ran right in front of me. And instead of tripping on him and falling, I was able to fall backwards with strength and avoid a whole fall. That was just one simple example. I've seen so many people. I've been a patient at UW now for about 2 years, and I see a lot of older people. And I have seen them not know how to fall, carrying bags and tripping, and not dropping the bags or trying to recover from it, but flat on their face, being carried off on stretchers. And that's just one example. So I feel very confident now that my body will do what it needs to do to recover before I do a fall. And I really appreciate that about the program.
I'm with these ladies. I'm the backup instructor to Bobby, and we're both certified. We had to become certified in order to teach the SAIL class. And my background was a registered nurse for 52 years, and I specialized in employee health and infection prevention and control. And the one thing about falling that people really don't think about that often is they think about the event when it happens. But the quality of life of the person who falls changes dramatically once they have experienced a fall. So if we can prevent people from having a compromised quality of life in their older years, that is really a key focus as we try to prevent falls. So thank you.
I'll be very brief. Ivan really said everything perfectly, but representing the fire department, I'm with East Pierce Fire and Rescue, and I'm one of 2 fire departments that are represented on the Pierce County Fall Prevention Coalition. My former assistant chief of EMS used to call us the canaries in the coal mine. Because while we heard in the proclamation about all the falls that result in injuries that go to emergency departments and hospitals or unfortunately result in deaths, we don't hear about those individuals that slide out of bed, call 911 to be picked up. Our firefighters go, very well-meaningly pick them up and put them back in bed. And maybe their primary care provider doesn't even know that they're falling because they don't get those messages through the healthcare, coconut telegraph to tell them that this person's had a fall and they're now in the emergency department. So one of the things that I'm looking at with the fire department is analyzing our 911 calls for falls. To date, from January 1st to August 31st, 19% of our EMS-related 911 calls have been dispatched as falls. 37% of those were not taken to the hospital. And what I'm trying to do in teaching our providers is to say nobody slides out of bed for no reason. So if you're going on a lift assist, please investigate further. Take a set of vitals. Find out what's been going on the last few days. Maybe they've got an infection cooking, that we can get them to the hospital and get them treatment. Refer them over to our mobile integrated health program, which I do fall prevention through. And we can reach out to them in the home, do a home safety evaluation, get some fall prevention education on board early, and hopefully prevent that next fall, which may actually result in a trip to the hospital that then adds to the statistics that we hear about. So working with fellow partners in other fire districts and working with the State of Washington Department of Health to look at Pierce County data. Unfortunately, Pierce County has the 4th highest amount of falls in the state. So working with the Department of Health to figure out ways that we can address fall prevention from a little bit of a different perspective, meeting people where they are in their homes and identifying ways to keep them safe. So thank you so much for your time and allowing us to be here on this proclamation.
Thank you all for being here, and I'm going to see if any of my colleagues have comments. We'll start with Councilmember Krueger.
Thank you, Madam Chair. And I just so much appreciate you all coming here for this. And I want to say I kind of pulled rank on being the one who gets to read this because I'm the one closest in this category. And I have fallen, and there's a big difference from when I was younger and I could tumble versus now when I'm like, am I strong enough to catch myself? And I think of my mom, who actually her bones would break before, and then she would fall from that, and the importance of the strength. And I want to add to that rebounding, and you might put that on your repertoire, because that's how the astronauts got their muscle back, was from rebounding. And my balance is so much better from that exercise, and it's fun. And you know, don't stop the other ones as well, because they too are important. But I am just grateful that you have a program to make folks aware of that. And I've noticed none of you are in walkers, and that's awesome. And that's where I'm trying to make sure that I don't have to deal with that. It wouldn't be fun. And you just appreciate, you know, you sharing all that, and keeps me on my toes. Thank you. Thank you, Madam Chair.
Thank you for the comments, and thank you for the comments. I was going to try and make a joke, and it just went away. It's been that kind of day. So, Councilmember Yambe.
Thanks, Madam Chair. And thanks to my colleagues for bringing this proclamation. I think this is really important. As somebody who lives with older populations in my household, you recognize the real importance when you start walking around with them and recognizing that in our country, just like some of the Western countries, that sidewalks and our roads are often not built with pedestrians, but especially seniors in mind. I think it's startling that in 2020, our country spent $53.3 billion in costs for non-fatal falls, which shows how expensive this is and how taxing it is to our system, when we are not investing in just fall prevention programming that, you know and I recognize that, so my mom uses our laugh swim classes, which is the, senior programming for, building some strength and keeping what little, muscles that you have and trying to, because you don't get it back after a certain age. And so, recognizing that, she tripped during the pandemic on a little uneven sidewalk in the city of Fife, where I live, and she tripped and fell, broke a bone or two. And, just recognizing that these are very expensive, and just the little bit of prevention that can be done goes a long way. And for us who are not yet there, about I think 2050 becomes the tipping point where millennials start becoming seniors. And then that will be huge amounts of people who are going to be going through these issues, and recognizing that our infrastructure is not designed with that. And so, here's good warnings and good heads up that, if we don't get better at this, if we don't get smarter at this, it's going to continue to cost us, and if we don't make investments, because everyone gets older. So I appreciate you all bringing this attention. I appreciate all that you do to help spread awareness and help those who are most vulnerable, navigate through these things, because some of these are simple little things to build just a little bit more muscle and keep what you have and stay out of the hospital, which everyone else has to eat the costs. And, if there's so many people who are breaking bones and you can't see other people because, the resources are being spent. So appreciate all your advocacy on this, and so I appreciate my colleagues for bringing this proclamation forward.
Thank you, Councilmember. We will go to Councilmember Denson.
Yes, thank you, Chair. Thank you all for all of your hard work. I learned a lot through the proclamation. The statistics are frightening, But at the same time, falls are preventable, so there's things that we can do. So that's the good news. I want to especially thank my District 7 friends from the Key Peninsula for making the drive out here. I learned so much from you because I think I just thought fall prevention was all about balance, which that is preferable, right? Not to fall in the first place. But Linda, what you mentioned about trusting your body and knowing how to fall and trusting your instincts, that was new to me. So that's so important. And I'm really grateful to you all for bringing those resources to the community. I love what East Pierce is doing in terms of looking at the data and identifying folks, especially that don't take the ambulance ride to the hospital. Those are absolutely folks that would be so great to make sure they're aware of programs like you all have at the Key Peninsula Community Center. And I know that you have as well at East Pierce, and we have throughout the county, to make sure those folks hopefully will engage in some of the sail activities, the Tai Chi for balance, or the other fall prevention programs that we have going on. So thank you all for your hard work. What you're doing is saving lives and certainly improving the quality of life for our seniors. Thank you.
Thank you for the comments. We'll go to Vice Chair Herrera.
Thank you, Chair. It's good to have the awareness. Doing the physical activity is really important. I have a neighbor who I help with his farm, and he is 98 years old. And he told me that the best thing for your health is farming. He gets around quite a bit, and I help him with his farm. And when we plow the field, there's no book on helping a 98-year-old get on and off a tractor. But we do that, and it's a little scary. But, it's really important to stay active as part of the whole thing, right? And that's part of it. So thank you for bringing the awareness. Thank you.
Thank you, Vice Chair. I will just conclude with my gratitude for the event to spread the message about why this is important, the resources that are out there. So it's in the Melcoram YMCA, which is in the South Hill, Puyallup area, and it's on the 22nd. And I know there's more information on our Aging and Disability resource. So if you just Google Pierce County ADR, you'll find us. And would love to share the information. And the other thing is, it can be good for not just seniors. Like, you're probably caring for a parent, or you will someday be a senior. So you don't have to be over 65 to learn this stuff now. You can learn it early to share the wealth with your aging parents or aunts or uncles, siblings, and eventually yourself. So just please be aware. And we're going to go back to Councilmember Krueger.
Thank you, Madam Chair. I just remembered perhaps some other words of advice in the sense that for the younger gals or middle-aged gals who are investing in high heels, that I highly recommend that you maintain that so that when you have a wardrobe of shoes, you can still wear them when you're older, because those can be difficult if you have not maintained strength in your ankles and knees and feet. So just sharing. Thank you, Madam Chair.
That's an option. Or you could go my route and just not wear high heels.